Good afternoon, everybody. Thank you so much for joining the 2022 open enrollment meeting for Heritage on the Marina. This meeting is being recorded, so if you're not speaking, I would just kindly ask that everybody put themselves on mute. If we could save all the questions to the end, that would be great. By the way, my name is Stacy McFadden, and I am with Heffernan Insurance Broker, and we are the go-between between the insurance carriers and the HR department. We are an advocate for you as the employee of Heritage on the Marina. So if you're ever having any issues with claims or accessing care or anything unusual that you are might be a little frustrated with solving yourself, feel free to contact me. So here's what we're going to cover today. We're going to talk about what's open enrollment, what's new for the 2022 plan year. We're going to review the medical and vision benefits offered through Kaiser, the dental, the basic life, AD&D, disability, and voluntary life, as well as a value-added services offered through Sun Life, the enrollment process, and we're going to save the questions until the end. So open enrollment, this is the one time a year that you can make any changes by switching between the medical plans, the dental, or the vision plan options. You can enroll yourself or remove yourself and add any family members to a line of coverage with the understanding that you yourself are enrolled on that line of coverage as well. So any open enrollment changes that you make will be effective starting January 1st, 2022 through December 31st, 2022, and they're binding for the entire year unless you have a qualifying change in family status, such as a marriage, a divorce, adoption, birth of a child, or adoption of a child, or involuntary cancellation of another employer health plan. What's new for 2022? Well, there are not any benefit changes to the benefits offered by Kaiser Permanente or Sun Life. The only change is there is a slight minimal increase to your employee contributions for the 2022 plan year. So now I am going to turn the mic over to Karen with Kaiser Permanente. She'll be discussing the plan options and information available there.
Perfect. Thank you so much. Stacy, can you hear my audio okay?
Yep, you're good to go.
Okay, awesome. Hello, everyone. Good afternoon and welcome. My name is Karen and I'm part of your Kaiser Permanente team. The purpose of this presentation is to go over your health plan options and to also highlight some of the tools and wellness resources that are available to you as a Kaiser Permanente member so that you can make the most out of your membership. So at Kaiser Permanente, you get care and coverage, and your healthcare is connected. It is integrated. So what does that mean? That means that you are the center at everything we do. You can use our Kaiser Permanente facilities, our hospitals, our medical centers, our pharmacies, our labs, the health plan, your doctors, the nurses, the specialists. All of them are connected and they're connected to you through your electronic medical record. So you don't have to repeat your stories. When you receive care at Kaiser Permanente, your care is connected and it's also personalized. So it's hassle-free for you. You also have the ability to choose your Kaiser Permanente doctor. You can browse our online doctor profiles online at kp.org/search doctor, and you can make your selection that way. You can change your doctor at any time for any reason, no questions asked. And it's effective right away. And we also don't charge you anything for changing your doctor. So the important thing here is that we want you to find a doctor that resonates with you, and so that you can establish yourself as a patient with them. In addition, you can see your doctor in person at one of our Kaiser Permanente facilities. And in addition, you also have the option to connect with them virtually. So for example, telehealth is available. So you can email your doctor at no charge. You can also meet with them virtually via a video visit and also via a phone appointment. So just those are just a few number of ways that you can connect with them virtually. And of course, we can't forget about the advice nurse line that's 24/7. And the advice nurse line is a great phone number to keep handy on your cell phone. Should something happen to you or, a young child or really anyone under your plan, after hours, in the middle of the night, on the weekend, because they can help you 24/7 and give you clinical advice. Once again, you can manage your care on kp.org or by downloading our Kaiser Permanente apps. On the apps, you'll be able to manage your appointments. So either make an appointment, cancel them, reschedule them. You should be able to refill most prescriptions and view most lab results. Again, a great feature that I really enjoy on kp.org or the app is the ability to email your doctor's office. And again, the emailing is at no charge, and you usually get a response within 2 business days. You can also manage your coverage, track your costs, pay a bill, and much more. What happens when you're away from home? Let's say you're traveling for work or you're on vacation, you're in a different state or maybe out of the country. Well, the beauty of Kaiser Permanente is that you're covered anywhere in the world for emergency and urgent care services. If at any point throughout your travel or your trip, you can give us a call at the 951 phone number listed on the screen, and we can help you get connected with a representative that can guide you with each step of the way. So whether it's helping you before your trip or if something is happening during a trip. For more information, please reference kp.org/travel to get a little bit more information about information should you be going on a trip. We have an abundance of healthy resources, and the few that are on the screen are wellness coaching by phone, and this program is available to you at no charge. It's over the phone, and you can connect one-on-one with a wellness coach that will help you reach a health-related goal, whether it's eating better, sleeping better, reducing back pain, or maybe reducing the amount of time you spend on a screen. Whatever your health goal is, the wellness coach will work with you and create a personalized plan to help you get there. We also offer healthy lifestyle programs, different health education classes online, and also some of them may be in person, but a lot of them are online at the moment. And of course, kp.org offers an abundance of resources such as podcasts, healthy recipes, online videos, and much more. One great resource that I'd like to highlight is the ability to get 25% off chiropractic care, massage therapy, and acupuncture when you see a provider in the ASH network. It stands for American Specialty Health. So as long as you're a Kaiser Permanente member, and if you would like to seek those services that I just mentioned, you will get a 25% discount, again, as long as you're seeing a provider in the ASH network, because that's who we contract with. We also have a partnership with Calm and ClassPass. So for more information, I encourage you to visit kp.org. Awesome. So a little bit deeper dive into the wellness coaching. So again, the wellness coaching is over the phone and it's available to you at no charge. You'll connect one-on-one with a wellness coach, and they can help you with any health related goals. And here are some examples. If you want to become more physically active, if you want to eat healthier, reduce your stress, quit tobacco, or maybe maintain a healthy weight. This is especially great during the holidays, but really any time of the year. And also the member discount program that I just touched upon, you get 25% in discounts when you see a chiropractor, acupuncture, acupuncture care, massage therapy within the American Specialty Health Network. Again, we also have a partnership with Calm. Calm is the #1 app for sleep and meditation, and it offers an abundance of self-care resources such as guided meditations, relaxing music, even bedtime story for adults. So take advantage of Calm. It's not listed on the screen that we're seeing here, but it is available to you as a Kaiser Permanente member. And also ClassPass. We have a partnership with ClassPass, and what you'll receive is a reduced rate on live stream fitness classes or classes that are available to you on demand at no charge. And there's over 4,000 on-demand fitness workouts that you can get with ClassPass. For example, classes such as yoga, dance, boxing, and even Pilates. Let's review your traditional HMO plan. So let's review how your HMO traditional plan works. So on this plan, remember that preventive care, such as your annual physical once a year and your flu shot once a year, are at no charge. For the most part, you're paying copays for most covered services, including your prescriptions, and you don't have a deductible on this traditional HMO plan. So nothing for you to really no deductible for you to really keep track of. Pretty much everything is a copay. It's simple, it's straightforward, it's predictable, it's easy. And you don't need a referral for certain specialties like optometry and obstetrics gynecology. Also, last but not least, your out-of-pocket maximum helps you limit how much you could spend for care each year. So that's a great number to, maybe draw a little star next to, and just remember that your maximum out-of-pocket maximum resets during every year during your accumulation period. So this slide is a highlight of preventive care at no cost. With preventive care, remember that there are preventive care services depending on whether you're for men, for women, and for children. So I always like to say there's 3 different categories. Depending on which one you fall on will determine what preventive care services you are eligible for, but you can always connect with your Kaiser Permanente team to learn more or visit kp.org. Some examples of preventive care include, like I said, your annual physical once a year, your flu shot, cancer screenings, cholesterol and blood pressure screenings, immunizations, routine prenatal care, and well child visits. This is a highlight, a glance of your traditional HMO plan. So remember, there's no deductible on this plan. What you're paying is a copay for, most covered services. So everything is simple, it's easy, it's predictable. You know exactly what you're paying for care. A doctor's office visit is $20, a copay per visit. And something that's actually not on this screen is that remember, telehealth is at no charge. So any emails to your doctor, video visits, or phone appointments, like I mentioned earlier, those are at no charge. So take advantage of telehealth when available and appropriate, of course. Preventive care, again, is also at no charge, and pretty much everything down the line is going to be a copay. For the purpose of time-saving purposes, I won't go through each one, but just know that there haven't been any changes, and everything is pretty much a copay. Two things that I want to highlight is, number one, hospitalization is a $0 copay. So there is no charge for hospitalization. You also have an allowance for eyeglasses or contact lenses every 24 months in the amount of $175 in allowance, not to exceed more than $175. That is your allowance. And for prescribed medications, you can enroll in the mail order program. So instead of driving to the Kaiser Permanente pharmacy and waiting in line, you can save yourself a trip and have those prescriptions mailed to you at no charge. You'll still pay the copay for your prescription, but the shipping and the mailing and the handling is going to be at no charge. Next, let's review, dive deeper into your deductible HMO plan. So let's review a few key terms. So what is a deductible? A deductible is the amount you are responsible for paying for covered services each year before Kaiser Permanente starts paying. So depending on your plan, you may pay copays or coinsurance for some services without having to reach your deductible. And what is your out-of-pocket maximum? I like to think about the out-of-pocket maximum as my safety net, or like as the roof of a house, basically meaning that that's the most you'll pay for most covered medical services each year during your accumulation period. For a small number of services, you may need to keep paying copays and coinsurance after reaching your out-of-pocket maximum. So just be mindful of that. And remember, your deductible and out-of-pocket maximum do reset each year during your accumulation period. What is a copay? So a copay, I typically like to explain it as in your benefit summary, for example, it's when you will see the dollar sign, and it's basically the set fixed amount that you will pay for covered services. For example, a $20 copayment for an office visit. Next, let's go over coinsurance. So what is coinsurance? So I like to explain this one as when you see a percentage sign. So a percentage of the charges that you pay for covered services. For example, if your plan says a 20% coinsurance for a $200 procedure, it means you pay just $40. So 20% of the $200. So at a glance, this slide highlights what you would pay for most covered services on this deductible HMO plan. So remember, this plan does have a yearly deductible. It is $1,000 for an individual, $2,000 for a family. However, the beauty of this plan is that the deductible does not apply to all services. For example, your doctor's office visit is still just a copay. It's a $20 copay per visit. So that's a great example of that. Remember that preventive care is also at no charge. So you don't have to pay a copay for preventive care, such as your flu shot or your annual physical once a year, etc. And again, something that's not on this chart, but that is also at no charge on this deductible HMO plan is telehealth. So similar to the HMO plan, any telehealth services such as emailing your doctor, scheduling a video visit or a phone visit, those are at no charge. So I encourage you to use telehealth when available and appropriate. X-rays and lab tests are a $10 copay per encounter, and the deductible does apply to some of the major services. For example, any MRIs, CT scans, and PET scans, outpatient surgery, hospitalization, those are at a 20% coinsurance. And again, the details are on the slide. Urgent care is a $20 copay. So again, not subject to the deductible. Emergency care is subject to the deductible. It's a 20% coinsurance after the plan deductible, and it's waived if you're admitted to the hospital. Routine eye exams are at no charge. You also have an allowance for eyeglasses or contacts every 24 months, $175 allowance, and prescribed medications for up to a 30-day supply are also at a copay. So again, if all of your copays add up to your out-of-pocket costs of all of your cost shares, whether it's a copay or current co-insurance, if they add up to your out-of-pocket maximum, which is $3,000 for an individual or $6,000 for a family, then you would not pay for most covered medical services for the rest of your accumulation period. And again, everything resets every year during your accumulation period. Again, the beauty of this deductible HMO plan is that the deductible doesn't apply to all services, and we went over what it doesn't apply to. Remember, take advantage of preventive care because it's at no charge, and you get your screenings and exams done. Telehealth is also at no charge, and also the mail order program is also available to you on this plan. So you'll still pay for your prescription, but the shipping and handling of your prescription to be delivered to your home, that is at no charge. To get more information about the tools to help you better understand and manage your deductible plan, your deductible HMO plan, you can visit kp.org/deductible plans. Online, once you register on kp.org with your username and your password, you'll be able to view your coverage, view claims, summaries, and even pay your bill. Something that I highly, highly encourage you if you are on this deductible plan and maybe perhaps getting a surgery or something of that nature, you can go on kp.org and get an estimate by using our estimates tool of about how much it's going to cost. So for example, if you are planning on having, a baby or maybe a knee surgery or some type of procedure, you can get an estimate online so that you have a better idea of how much that's going to cost and you can plan for it financially. Oh, perfect. There you go. This was actually the next slide. So yes, before you go in for care, you can, we definitely encourage you to get an estimate online. The estimate, again, is going to help you just better understand how much the treatment, the procedure, the test or other medical service will cost. And this will help you track your expenses. So that way you can track the services that you pay for and see how close you are towards reaching your deductible and your out-of-pocket maximum. So it's a great way to track your care and track your expenses. So what happens after your visit? Well, you can expect to get an explanation of benefits, also known as an EOB statement, and this will help you track the care you've received, and it will allow you to see how close you are towards reaching your deductible and out-of-pocket maximum. You will also get a bill if your payment at check-in did not cover the full cost of the services you received. So for example, if you have an appointment and you walk up to the Kaiser Permanente, representative at check-in, the receptionist, and she takes partial payment. So let's just say she takes a certain amount. Let's just say, $20. And then thereafter, you receive other care, more care than that, then you will be billed the difference. So just be on the lookout, if you do make just a partial payment at check-in that does not cover the full cost of the services you received, you may get a bill for those services. Thank you so much, and I'll pass it over to whoever is next.
Thank you so much, Karen. Now I'm going to pass the mic over to Tina, who's with Sun Life.
Hello, how is everybody today? We're going to be talking about the 2022 dental plan offerings. May I have next screen, please? Okay, we all know the importance of dental insurance. Obviously, it's going to protect your smile and it helps prevent other health issues. Um, the example of that would be if you have, let's say, periodontal disease. That is something that can affect your heart, that can maybe even give you a stroke, a heart attack. If you have diabetes and you have periodontal disease, your body is focusing on that major infection in your mouth and not on your diabetes. So those are all reasons for you to go to your dental office. With this PPO plan that you have lower out-of-pocket expenses. Next screen, please. Thank you. Okay, yeah, we were just talking about periodontal disease, which can lead to receding gums. So it makes your teeth look really long, bone damage, loss of teeth, and can increase the risk of other health problems such as heart disease and diabetes. Nearly 1/3 of all adults in the United States have untreated tooth decay. And, when you have some untreated tooth decay, it can get worse for you. You can end up with a root canal and a crown. And if you go in regularly and get your cavities taken care of, it will take care of a lot of that. Not to mention, cavities usually cost a lot less to fill than paying for a root canal and a crown. Next screen, please. Okay, what you're looking at is $2,500 as far as a calendar year benefit. And let me tell you, that's awfully high. Most of the offices I work with have $1,000. Once in a while, we see $1,500. With $2,500, you can really accomplish some things. I normally recommend, if possible, that you go to the dentist at the end of the year in November and December and use up all your dental insurance that you have left, because once your new year comes in, then you have another $2,500, which allows you to get $5,000 worth of coverage in a couple of months. Your annual deductible for an individual is $50. For the entire family, it would be $150. There's also ortho coverage, which is $1,500 max. You're entitled to 4 cleanings per year, which will be covered at 100%. That also includes bite wings, which is x-rays of your back teeth, and a fluoride treatment. When we're talking basic coverage is for your fillings, oral surgery, endodontics, periodontal disease, and that's covered at 80%. And as you can see, these figures are for in-network and out-of-network, which again is very good coverage. Now, the major work, it consists of bridge, crowns, dentures. That's covered at 50%. And the orthodontics, again, you have a $1,500 maximum, which is paid out at 50% of whatever the bill is. May I have another screen, please? Okay, 2022 life and disability plans. Okay, what do you need life insurance for? Obviously, if something tragic happens and you or a member of your family passes away, especially if it's an income generating member, their household expenses can be overwhelming. This is for financial support of others, your loved ones. Shared debt responsibility. A lot of us share debt with someone else. We might be helping somebody pay off a school loan, or, we have family members that we help with rent occasionally, groceries, those kind of things. You can leave your life insurance money to somebody to help out with that. Hired help. We're looking at taking care of children for daycare. That's extremely expensive in this country. If you want to leave an inheritance or even a nice gift to a church or the SPCA or something that you really care about. And then, of course, funeral or medical expenses. Sometimes there are extraordinary medical expenses left over, and the life insurance will certainly help you with that. And funeral costs are not inexpensive either. So there's so many reasons that you would benefit from life insurance, even if you think you may not have anyone to leave money to. There are lots of things for you to consider. Next screen, please. Okay, this is an employer paid benefit, which again is a wonderful thing. You have $25,000 in life insurance already that is available to you at no cost. Plus, you have AD&D coverage with that. AD&D stands for accidental death and dismemberment. And what that does for you is, should you pass away in an accident, your life insurance doubles. So in that case, your beneficiaries would have $50,000 instead of $25,000. Also, there's dismemberment that would cover you in the case of a loss of an appendage, a finger, an arm, a leg, something not too nice to discuss, but we still have to. Okay, next screen, please. Okay, how much additional life insurance and AD&D can you actually purchase if you feel that $25,000 is not going to get you where you need to help out your families or your loved ones? As far as the employee is concerned, you can go up to $500,000. You cannot exceed 5 times your annual earnings, and that's in increments of $10,000. For your spouse, whatever you have for your spouse, it cannot exceed 50% of what you as the employee have as coverage. But you are able to go up to $250,000, and that's in increments of $5,000. As far as your children are concerned, you can go up to $20,000, and that's in increments of $2,000, and again, not to exceed 50% of the employee coverage amount. Next screen, please. Okay, here's an example of how this works. The guaranteed issue amount is when you are a new employee and this is offered to you. We ask no health questions. Basically, if you want it, this is what you can get without answering any health questions at all. It's up to $50,000. If you want to go over that, up to the $500,000 amount, then we do ask you to fill out an EOI, which is called Evidence of Insurability, and that is proof that you have good health. If you are not a new employee and you want to increase it, you will have to fill out an explanation of benefits also. I mean, an explanation of an EOI also. That is required when you don't take the guaranteed issue when you're first hired. That also applies to the spouse. So an EOI would have to be filled out on the spouse if you want to get more life insurance. Again, you can go up to $250,000. And the same thing for children. Next screen, please. Okay, now we're talking about long-term disability. This is also another benefit that your employer is paying for you. So you do have this. And what happens is, should you have an injury that disables you, that where you're not able to come to work, whether it's on a full-time basis or a part-time basis, you do have long-term disability insurance available to you. This benefit starts 90 days from the day of your disability. So that is the long-term disability that you have. What it does for you, it will replace up to 60% of your total monthly earnings. It can go up as high as $8,000 a month. It depends what 60% of your income is. We will pay that up until Social Security, normal retirement age, or possibly even longer, depending on what your disability is. Also, there is a pre-existing clause that you need to be aware of. Once you are covered with long-term disability and you make a claim, we do go back to up to 3 months before you were originally covered with the disability insurance to see if you had any kind of a treatment or discussion or tests for the disability that you have. That's pretty much it about the long term. If you have any questions, I will certainly be available. I will stay on afterwards if that's okay with Karen. Again, it protects your savings and your paycheck so that you don't have to go into those. You'll be able to use your long-term disability payments. And again, you can use it for whatever you want, your everyday expenses, rent, car payment, etc. Okay. What does long-term disability insurance cover for you? Any injury that is disabling, a disabling illness, a heart attack recovery, a stroke recovery, a cancer recovery, anything that you need to recover from, basically. Next screen, please. And again, this is something I've already covered, but I'll go over it again. 60% of your monthly income to a maximum of $8,000 per month. It starts 90 days after your illness or injury starts. That's called an elimination period. And you do receive benefits up until your Social Security retirement if you need it that long. There are also value added services that we are offering to you. And basically, what that is you have 3 face to face visits per occurrence with experienced clinicians to help address any personal concerns that you may have. This goes all the way with financial issues, any challenges that you have psychologically. You can also get will preparation. The will preparation is online and you can do that on your own. You don't necessarily need someone to help you with that. Next screen, please. Emergency travel assistance. If you travel and you're 100 miles or more away from home, it doesn't matter if you're in this country or in another country, you're able to get help. We will be able to find someone who speaks English. We can help you with any medical consultation, evaluations, foreign hospital admission. I think this might be on another screen. Can I take the next screen, please? Yes. Also, identity theft. But these are things that you are a member of already, but you do need to contact them to give them things like your credit card number. And if you're traveling in another country and you have chronic health issues, we will also take note of that and be able to pass that on should anything happen. If you're unconscious, we will have those records. Also, medical recreation, we will be able to bring you back home with a medical or a non-medical escort if necessary. May I have the next screen, please?
That was it on your portion, Tina.
Okay, well, I just wanted to also add with the medical recreation, that is a very big deal. If you're in another country, it can take 20, 30, 40, $50,000 easily or more to get you back home. So this is a benefit that if you're traveling, you certainly want to make sure that you're registered with them. And that is it.
Thank you so much, Tina.
You're very welcome.
The
Have a good day.
Thanks. The next value added benefit is offered through Heffernan Insurance Brokers, and it's LifeMart. So the LifeMart plan offers discounts for you in one convenient location for almost anything you could possibly think of that you might need. Anything from parks when they're semi-open, but I'm not quite sure how many people are going through, through them. Vacation packages, car rentals, and hotels, as well as gifts and retail shopping. They offer discounts for child and senior care products, movie tickets, and video rentals. So this benefit is offered to Heritage on a Marina employees at no cost whatsoever. And to sign up, you just need to go to discountmember.lifecare.com, and the registration code is HEFF benefits. So I would just like to talk about the enrollment process for one second. Heffernan provided a benefit election form that Heritage on Marina is asking or requesting every employee to complete. And it's if you're going to enroll on a benefit, you're going to select which benefit you want and acknowledge the fact that it comes at a per paycheck employee contribution. And if you're waiving benefits as well, that's included in the form. So all of the forms need to be completed and returned to HR by Friday, December 10th. Oh, I just discussed that. So this is what you need to do by Friday, December 10th. You need to review what your options are, the 2 medical plans with Kaiser, and the vision plan that's embedded in Kaiser, the dental plan with Sun Life. If you're a new employee, you'll automatically, correct me if I'm wrong, HR, be enrolled on the life and disability programs because those are offered to you at no cost. So you want to review your plan options for 2022 and determine which plan is right for you and your family if applicable. And then you need to complete the enrollment change form or waiver form for the 2022 plan year and return to HR. And now is a good time to remember to update your beneficiary. If you had any major life changes, such as a marriage or a divorce, you want to make sure that the person that you want to get your life insurance benefit is reflected on a beneficiary form. And just a friendly reminder that open enrollment is November 30th today through December 10th. And now we'll open it up for questions. Do we have any questions from Heritage?
We're just giving everybody a moment to see if there are any questions.
Okay, thank you.
Thank you. Anybody? Now's the time to ask. Medical, dental, vision, disability, long-term, anything? No?
Is it the same amount you paid last year
For
our insurance?
the insurance cost would go up for the medical piece. There was just one question about the cost for medical, and I did confirm, yes, it did increase slightly from last year.
Yes, that's correct.
Anything else? No? No questions. Thank you so much.
Thank you so much and enjoy the rest of your afternoon.
You too. Thank you.
Thank
Bye.
you. Bye-bye.
Bye-bye.
Thank you all.
Thank you.
Yeah. If you have any questions, you can start them from your end. Okay. And then the status of the enrollment or the waiver form by Friday, December 10th. Okay.
Everybody, please make sure you sign the sign-in sheet.
Thank you. I was trying to figure it out.
So we'll be back at 3:30 then.
Okay, so how do we shut this one down? This right there. You know why? Because this is not
And it's a Mac,
it's a Mac. I don't remember the last time I used a Mac.
yeah.
Because when I
Well,
was
we just-
training.
Just click on that, no, the